If your baby is fussy or uncomfortable, no matter what you try, it may not just be normal or common colic or normal baby behavior. I'm Dr. Steve Lako with Lako Family Chiropractic, and I specialize in pediatric chiropractic care. And I want to go over some signs with you today that your baby's fussiness could be because of physical discomfort and how we can get that addressed. Now, before I start, I want to make sure to say that this isn't the cure-all, be-all for every ailment that a child may have. This is for specific cases that we see in our office after a very thorough exam. My suggestion would be to keep the schedule with your pediatrician and make sure to get regular checkups. And from there, we can support you. First of all, I want you to know that having a fussy baby is exhausting. Having a baby in general is exhausting, but on top of that, having a baby that is unconsolable, cries all the time, very, very sensitive, can be very challenging. I know a lot of patients that come in and say that their doctor said that it's normal for a baby to cry this much. It's just colic, let's medicate for that. Or let's just wait and see if the baby grows out of it. If the baby is fussy and crying that much and consistently, there's probably an underlying cause that we need to figure out. Just think about it. If an adult had neck pain or a headache or something going on, they'd be able to go into the doctor and describe all of their symptoms and work with the doctor. Now, with a baby, they can't just describe what is happening. So I know that the first injury we all go through is through the birthing process. Even a natural delivery has some sort of birth trauma with the baby. Also, when the baby's in utero, being in that form and being in that position for that long can cause tension on their neck, their spine, their bodies. So when they are born, 95% of the kids that come into my practice, I see some misalignments in their neck, which is huge for their neurology, which can cause a lot of issues throughout their body. Their mid-back, which can cause issues with their digestive tract and their digestion, and then their pelvis and lower back as well. So it's very important to check a little bit more in depth of what's going on with these kids. So what should you look for? Here are some signs that could be causing your baby's fussiness. The first one is breastfeeding or bottle feeding. If it is challenging to feed them because they are not turning their head to one side equally to the other side, if they're not latching properly, this could be an issue with their neck. They're physically not able to turn their head to the certain side in order to get into the proper position to feed. This can cause a lot of issues and a lot of frustration with parents as well. The second thing is sleep. If they are not sleeping beyond normal baby patterns, if they will not sleep anywhere other than on top of you, if they startle to wake over the smallest noise, if they just will not settle and go to sleep, if they're not napping well, napping for 10 minutes here and 10 minutes there is not a good thing. They should be napping for much longer than that. This could be that they are either physically uncomfortable or their nervous system is just functioning at a higher frequency, and we need to calm that nervous system down. Third is digestive issues like constipation, gas, even things like reflux. If they have like a very tough, distended belly, that could be very uncomfortable for kids. And the portion of the nervous system that's coming through their upper and mid back go to their entire digestive tract. So we need to make sure that we're looking at that and clearing any kind of pathways out so their digestive system is working properly. Fourth is preferential positioning. So does your baby want to and prefer to be turned to one side? The good test for this is in the car seat. Does their head slump to one side but never the other? When you put their head looking to one side, does it never go to the other side? Also, do they prefer sleeping on one side, or they always twist and turn to that one side but never the other? This could be restrictions in the neck and spine. The good news is that many of these issues can be addressed by a pediatric chiropractor. We use very gentle, specific techniques. We do not adjust kids like we just adjust adults. They're very soft, gentle, specific techniques. The amount of force that we use to adjust a baby is about the same force that you would check to see if a tomato was ripe. And using these gentle, specific techniques on the kiddos allows us to remove those restrictions in their body so that they can turn their head, latch on, they can sleep better, they're less fussy. their digestive system is starting to work properly. Because not only are we taking away the restrictions of their spine and joints, but we're also improving their nervous system and their neurology throughout their system too. We also work very closely with pediatricians and the kids' doctors. We know that having a support team is better than just having one. So we support each other to get the results that your baby needs. And also, research is showing that gentle chiropractic care, when performed by a trained pediatric chiropractor, is so beneficial to the kid's health. If your baby is experiencing one or several of these issues, it may be time to have them evaluated. It's not worth spending months of sleepless nights and tough days just waiting for them to grow out of it. In our office, we offer gentle evaluations to assess your baby to see what is the cause of their discomforts. So if you have questions or concerns, reach out to us. We have a lot of answers for you. In my next video, I'll talk about when the optimal time for the baby's first chiropractic evaluation would be and what that appointment will look like. A lot of parents are very surprised, pleasantly surprised, of how gentle and informative those appointments are.